Hello, thank you for listening to my presentation today. My name is Emma Davis Williams, and this presentation explores a topic that many of us encounter but don't always talk about, which is why clients lie in therapy and what are the consequences. I became interested in the concept of lying through my work on a helpline, and this led me to think about lying in a therapeutic setting. I noticed that clients often avoided certain topics or gave responses that felt safe rather than being fully honest. It made me wonder how common it was and what effect does it have on therapy. This curiosity became the foundation of my systematic review. Preliminary research told me that lying in therapy happens a lot, but it's not always talked about openly. And this is an important issue that can affect the therapeutic relationship. At the beginning of my research, I wanted to define lying and found that lying is more than just saying something untrue. It can also include leaving things out, or omission, downplaying feelings, which is minimizing, hiding thoughts or behaviours, which is concealing, or even making things up, which is fabrication. These aren't always deliberate lies to manipulate, but rather ways for the client to protect themselves emotionally. The concept of lying has a rich and complex history. In ancient Greece, philosophers were already debating whether lies could ever be justified. Plato introduced the idea of the noble lie. He argued that in some cases, deception by leaders might serve as a greater good, like maintaining social stability. Aristotle took a more moralistic view. He believed lying was a vice and truthfulness was a necessary virtue for a good life. Meanwhile, Augustine, in the Christian tradition, focused on the intent behind lying. He argued that it's not just about factual inaccuracy. Lying is defined by the intent to deceive. Later, Kant famously took a hard stance. He said lying is always morally wrong, even if it's meant to save a life. For him, deception corrupts the moral law. Modern psychological thinkers like Freud saw lying as part of our unconscious defences. Jung explored how we lie to align with archetypes. Adler linked deception to feelings of inferiority and social dynamics. So lying has long been viewed as both a philosophical and psychological issue, complex, nuanced, and deeply human. I decided that the systematic review would ask three main questions. What makes clients lie or hide things in therapy? What clients or topics do clients lie about? And how does it affect therapy outcomes and the relationship with the therapist? I chose a mixed method systematic review, including both qualitative and quantitative research. This allowed me to get a well-rounded view of the topic. I used critical realism to guide the review because it aligns well with the complex and layered nature of client dishonesty in therapy. I searched databases, PsycInfo, PubMed, and Web of Science. I used Prisma guidelines to document the search process, and I also used the SPIDER framework to decide which studies to include. After screening 916 articles, 11 were included in the final review. From each study, I collected key information, such as what kind of study it was, how many people took part, why clients lied, and what effects those lies had. I used the JBI checklist to check the quality of the studies and make sure the findings were trustworthy. The 11 studies I included were quite varied. 6 were qualitative, 2 were quantitative, and the others used mixed or correlational methods. This variety helps show different perspectives on why clients lie and what happens as a result. The studies included clients across diverse backgrounds, including those in general therapy, with suicidal ideation, high self-concealment, sexual concerns, self-destructive behaviours, substance use and issues, and from culturally different groups. Most studies found that more than half of clients admitted to lying in therapy at some point. In some studies, it was as high as 93%, the highest reported rate. Other studies consistently found rates between 58% and 84%. Dishonesty was especially common around emotionally charged or stigmatised topics, and these findings suggest that lying in therapy is not just the exception, it's the norm. But what are the motivations behind lying? The studies identified several key reasons why clients lie in therapy. The most common was to avoid feelings of shame, guilt, or embarrassment, especially around sensitive issues like sexuality, failure, or substance use. Clients feared judgment from their therapist or negative consequences, such as being hospitalised. Interestingly, some clients were motivated by relational concerns. They didn't want to upset their therapist or damage the working alliance. Others wanted to maintain control over the session content or feel they weren't ready to deal with certain topics emotionally. The consequences of client dishonesty are significant and wide-ranging. First, lying weakens the therapeutic alliance. Clients often report feeling disconnected or not truly understood when they aren't honest, and this can damage trust over time. It also reduces the overall effectiveness of therapy. When key issues are hidden, therapists may focus on the wrong goals or miss important opportunities for intervention. Some clients may eventually drop out because the therapy isn't addressing their core concerns. On an emotional level, clients often feel guilt or regret after lying, and this emotional burden can add to their distress and even impact their mental health further. They may also worry about being discovered, which creates anxiety during sessions. More critically, lies can mask serious risks. Studies reported clients hiding suicidal thoughts, self-harm, or substance use, which prevents therapists from taking appropriate steps to support them. Therapists may not even realise that this is happening. Some studies found that clinicians often miss deception, especially in clients who tend to conceal their thoughts habitually. If left unaddressed, this can lead to ruptures in the relationship and even early termination of therapy. The key interpretations from this review highlight that client lying is widespread and usually driven by self-protection and not malice. Clients may lie to avoid shame, embarrassment, or emotional discomfort and to preserve their relationship with the therapist. Importantly, this dishonesty is often relational. It's shaped by the client's perception of how safe, open, or judgment-free the therapeutic space is. If clients can sense a power imbalance or fear judgment, they're more likely to conceal important information. Therapists are not always aware that this is happening. Several studies showed therapists frequently miss signs of deception, especially when clients are high in self-concealment. This can result in missed opportunities to address crucial issues. However, lying doesn't always have to harm the therapeutic relationship. If addressed with empathy and curiosity, it can actually lead to repair and deeper trust. Therapists can help by assuming some level of dishonesty is normal and inviting openness using non-judgmental questions and feedback tools. The review had a few limitations to consider. Firstly, most studies relied on self-reported data, which can be biased, especially when asking clients to be honest about dishonesty. Few studies used a longitudinal design, so we don't know how lying might change over the course of therapy. Culturally, the studies were mostly from the United States or other Western countries, which limits how well findings apply to the clients from different backgrounds. Another issue is that very few studies examine therapist perspectives, so we don't know how well therapists can detect lies or how their style affects clients' dishonesty. Finally, there was a wide variation in the methods and quality between studies, making it harder to draw firm conclusions. Sensitive issues like suicidality or sexuality may also have been underreported, even within the research itself. To build on the findings of this review, future research could take several important directions. First, longitudinal studies would help us understand how honesty evolves across the course of therapy, especially as trust develops. Second, more studies should explore therapists' perspectives and how they recognise dishonesty, how they respond to it, and how their style might influence clients' openness. Cultural representation is another key area. Most current research is Western, and we need more studies from non-Western or marginalised contexts to understand how culture and stigma affect honesty. Research could also test tools or interventions to help clients feel safe enough to be truthful, like feedback forms or therapist training modules. Studying how clients talk about high-stakes topics like suicide or addiction would also be valuable. Lastly, future work could test and validate different types of lying in therapy, such as white lies versus full concealment, to see if they lead to different outcomes. These findings suggest several important implications for practice. First, we should expect that clients will sometimes lie, and normalise that this behaviour is a protective response. This removes shame and opens the door to honest exploration. An empathic, curious stance helps clients feel safe, and open-ended prompts like, "Is there anything you found hard to share?" can make it easier for them to be honest. Feedback tools like the session rating scale can help identify ruptures early on. Therapists also need to be sensitive to cultural, gender, and identity factors that shape disclosure, and remember that lying often signals emotional and safety rather than defiance. Responding supportively can turn deception into an opportunity for relational repair. Client dishonesty in therapy is a widespread but under-discussed phenomenon, with rates as high as 93%. Lies are rarely malicious. They are often self-protective responses driven by shame, fear, and a desire to preserve the therapeutic relationship. Clients are more likely to conceal sensitive topics such as sexuality, suicidality, substance use, and perceived personal failure. Dishonesty can harm the therapeutic process, weakening trust, delaying progress, and sometimes increasing risk. Therapists often fail to detect client deception, which underscores the importance of creating a safe, non-judgmental therapeutic environment. Recognizing lying as a relational and emotional cue, not as resistance, can support deeper therapeutic engagement and alliance repair. Ongoing research and awareness are vital to address this complex dynamic and in improving therapeutic outcomes. Thank you for taking the time to listen to my presentation. Please leave any comments with any questions that you might have.